Good morning, good afternoon, good evening, depends on when you're watching my video. Please subscribe and you will be uploaded with a lot of videos that is being loaded. I'm still your resource person, coming of Dawn. I was emphasizing on the physiology of drug abuse, and this physiology of drug abuse has been a tremendous topic and also a very conspicuous one, because it cannot be discussed without discussing about the limbic system. Following our previous lecture, we have been able to discuss on the structures of the limbic system and the functions of the limbic system, where emphasis were laid on trying to relate motivation, pleasure to that of emotion and behavior. Then now we are talking about the basic basic area of addiction. Why an individual becomes addicted to a particular event, either drugs or habit, or any particular thing that have that reinforcing behavior. We now say that individual become addicted to that. It is a simple, function of the area of the brain known as the ventral tegmental area. So this ventral tegmental area is otherwise known as the VTA by abbreviation, or it is also known as the dopaminergic center of the brain. Some people call it the reward system, because this is what is located down the hindbrain and go across to the forebrain, but the origin is at the mesencephalon, which is the midbrain. Then why it goes to the forebrain is for it to basically reinforce the function of the prefrontal cortex, which is very, very responsible for personality identification, reasoning, learning, thought process, and possibly it also initiate some sensitive response that have been received through the efferent nerves. Then we have first of all discussed that we have some basic structure of the limbic system, like the hippocampus, the amygdala. Then we talk about the thalamus. We talk about the hypothalamus, the subthalamus, the septal nucleus, and the habenula. In that of the hippocampus, we are able to talk on the three basic area of hippocampus, the dentate gyrus that helps in the reception of an efferent nerve or receptor from that of the paral hippocampal gyrus of the limbic lobe. Below the limbic lobe, well above, we have the cingulate gyrus. All these are very, very necessary for reception of impulses down to the limbic system. They want to talk about how does these areas relate to that aspect of addiction. And when I'm talking about addiction, I've said there is compulsive use of a particular substance or compulsive repetition of a particular habit, which might either be usual, which may either be positive or negative. It can be addicted to reading, can be addicted to a particular type of food, can be addicted to porn, can be addicted to sex, can be addicted to drugs, can be addicted to habits, that even games and other things. But now we are talking, what we are trying to emphasize on the basic, areas of the brain that is responsible for this addictive behavior. And why is it that a particular behavior that give that that give that pleasure or euphoric state of an individual will be able to be reinforced, and this process is known as reward system. And where is the reward system? The reward system is located in the ventral tegmental area of the brain, and this ventral tegmental area is located in the midbrain. Then it intercepts to that of the cortical aspect of the brain and also to the limbic aspect of the brain. The cortical aspect is where we locate the forebrain, and where the limbic aspect is where we get the nucleus accumbens. And this particular area of the cortical aspect of the ventral tegmental area can be known as the mesocortical area or mesocortical pathway of dopamine. Then we still have that of the mesolimbic pathway of the dopamine, which is the area that is trying to relate the ventral tegmental area to that aspect of the nucleus accumbens, which is also a basic structure, or nucleus that is very, very responsible for addition. And what happened to the nucleus accumbens? When the nucleus accumbens is being affected, then nucleus accumbens will always have a direct fibers that stimulates the frontal lobes. And the area of the frontal lobe that is being stimulated is the motor part of the frontal lobes. Then the motor part of the frontal lobe is basically responsible for that of compulsive behavior. That compulsive behavior is what is making an individual to become addictive. I remember I initially said that if not for the ICD and DSM classification of substance abuse or addictive or addictions in another group or dimension, I would have said that substance abuse is otherwise known as obsessive compulsive disorder, because it's something that you have to think of before it will be carried out. Remember, we used to talk about the efferent sensation when the eye, the nose, the ear, or the external receptors, let me say the sensory organ, the five sensory organs, is trying to send information to the brain. Then it will now be able to remind the nucleus accumbens the need for that particular reward event. And when that event that is supposed to be rewarded is being neglected, the individual potentiates what we call craving or anxiety disorders, or having what we call withdrawal symptoms. But if you were able to take these particular drugs or go into this particular habit, you'll be able to be yourself. And remember, you are causing more harm to your system, because there is a very clear notion that there have been an established physiological disorderliness in the limbic system. Hence, you keep craving, having withdrawal symptoms, and possibly may be intoxicated. And in the course of this, so many things will happen in the pre and postsynaptic pathway, because dopamine block the postsynaptic pathway, the receptor that is in the postsynaptic pathway. Then you see that the ligand-gated ion, the ligand-gated channel ion will be, of that of dopamine will be blocked. And when it is being blocked from the postsynaptic nerves of the neurotransmitter, the dopamine automatically will then raise to a higher amount in the cleft, that is a presynaptic cleft, and this presynaptic cleft is an area where there is an easy passage, just like a junction between two neurons, the presynaptic and postsynaptic neurons. That synaptic cleft is a passageway where neurons or neurotransmitters that is being released from the presynaptic neurons being targeted to the postsynaptic receptors, to that of the postsynaptic neurons. So if this dopamine is being blocked, this particular pathway, there will be an excessive or abnormal level of dopamine in the synaptic space. This synaptic space where there is increased level of dopamine will now lead to symptoms of schizophrenia or substance-induced manifestation in a psychotic way, or with substance behavioral or mental behavioral disorder with psychotic features, because the increased level of that dopamine that was unable to be absorbed in the system will now be found in the presynaptic aspect and that of the cleft, hence leading to behavioral excesses, leading to abnormality, and the individual will automatically, go back to the drugs, because the drugs will also act like dopamine in order to give the individual the feeling of euphoria. And from there, you will now go back to the drug, and from going back to the drug, the addiction continues. It's just like a circle. Addiction is just like a circle, because if you did not take it, it will automatically, cause a harm. The harm can be dangerous. The harm can also be a withdrawal symptom that is tolerable. Or if we detoxify that individual, the individual can also be okay. But in a nutshell, remember that we have the center where the dopamine is being, found in a cluster. This area is called the ventral tegmental area, which is the point that or area for addition, and where this ventral tegmental area have two nucleus that is responsible for this addition, for tolerance. When there is an induration in the nucleus accumbens, that will lead to increased addition, and the nucleus accumbens we have a nerve or a fiber that will automatically relate to the prefrontal cortex, telling the individual that you are supposed to, carry out a particular action that is lacking in your system in order to get that same excitability or euphoric state or elation. Hence, repetition of that occur. So addiction is otherwise is repetitive intake of drugs or repetition of a particular habit, that if that habit is not carried out, possibility of an individual manifesting with some physiological symptoms, which is known as withdrawal symptoms, and the craving will occur. Thank you. This is just a summary of my previous video that I discussed about the physiology of physiology of addiction. We still talk about the physiology of memory. That will be discussed later, and we also talk about physiology of emotion.